Hello friends, welcome to a new lecture today. In my last class, I have explained about lobar and bronchopneumonia. As I have said in the beginning classes, there are two different types of pneumonia on classification, that is airspace pneumonia and interstitial pneumonia. Airspace pneumonia is again divided into lobar pneumonia and bronchopneumonia. In my last two classes, I have explained about the lobar pneumonia and bronchopneumonia. And I have also explained that there are many organisms which causes lobar pneumonia or bronchopneumonia. For example, lobar pneumonia is mainly caused by the following organisms like Streptococcus. First, lobar pneumonia, most commonly it is caused by Pneumococcal Pneumonia. These are the list. I have the list. So, lobar pneumonia, it is mainly caused by Pneumococcal Pneumonia, Staphylococcal Pneumonia, Streptococcal Pneumonia. Streptococcal Pneumonia is same as Pneumococcal Pneumonia. It's just a mistake. And then Pneumococcal. The other gram-negative bacteria like Haemophilus Influenzae, Klebsiella pneumonia, Pseudomonas, Proteus, E. coli and influenza. These are different organisms causing lobar pneumonia. There are some more organisms which cause bronchopneumonia, like if you see, these are the organisms causing bronchopneumonia: Streptococci, Staphylococcus, Pneumococcus, Klebsiella, Haemophilus Influenzae, and gram-negative organisms like Pseudomonas. Anyway, this Klebsiella and Haemophilus Influenzae are also gram-negative. So, gram-negative organisms like Klebsiella, Haemophilus, Pseudomonas, and coliform. So, these are the different organisms causing bronchopneumonia. Then, now in this lecture, we will learn about each and every organism which is causing pneumonia. So, first, I would like to discuss about the pneumococcal pneumonia. Okay, so pneumococcal pneumonia is caused by, as you know, pneumococci or Streptococcus pneumonia. Okay, pneumococci is a diploid organism. It has two. Okay, it has two cells. So, it is a diploid. That is not diploid. You have to say it is paired organism. It has paired appearance. It is gram positive. Paired appearance. It causes, the clinical features are mostly similar. It also has fever, that is pyrexia. This pneumonia also has chest pain. Okay, this pneumonia also has chest pain, fever, cough. All those with sputum are common. What is specific for this pneumonia, that is pneumococcus pneumonia, is rusty colored sputum. There is sputum which is rusty, purulent sputum. Pneumococcus pneumonia causes rusty, purulent sputum. This is specific for this pneumonia. And this pneumococcus is penicillin sensitive. So, you can treat it with penicillin G. Okay, and there are also some vaccines which are available to prevent the recurrence of pneumococcal pneumonia. They are vaccines like pneumococcal polysaccharide vaccine. One is pneumococcal polysaccharide vaccine, and there is one more vaccine which is conjugated vaccine. Pneumococcal conjugated vaccine. So, these two vaccines will prevent the pneumococcal infection recurrence. So, when do we give these vaccines? These vaccines are most commonly given for immunocompromised individuals. Those individuals who have, who are using on steroids, who have HIV, who have sickle cell anemia. Okay, and also these are also given to the splenectomized individuals. We have already learnt it in post OPSI, that is overwhelming post-splenectomy infections. So, to prevent that, we use these vaccines. Before splenectomy, we give these vaccines to the patients. So, this is about pneumococcal pneumonia. Now, the next organism which I would like to discuss is Staphylococcal pneumonia. So, in the Staphylococcal pneumonia, this Staphylococcal pneumonia can be of two types. One is primary, the other is secondary. In primary, it is primarily affecting the lung. That is, other body organisms. Other body organisms are not affected. So, if you see, only lungs are affected in primary. Other body organisms are not affected. Whereas in secondary, it is a disseminated disease. First, there is some other infection. So, because of that infection, we get pneumonia. So secondary is disseminated disease. It is also called as generalized. It's not disseminated. The word generalized should be used. So generalized, it is a generalized staphylococcal pneumonia infection. It is a generalized staphylococcal septicemia or, okay. So this results in staphylococcal pneumonia. Now, the staphylococcal pneumonia, it also presents with cough, chest pain, pleuritic chest pain, similar to any other type of pneumonia. But the main difference here, in the lung, there are formation of abscesses. In the lung, there are formation of many abscesses. Okay, so these abscesses are formed. So these abscesses may erode into the pericardium, and whenever it erodes into the pericardium, it can lead to the so-called purulent pericarditis. So it can, the abscess, staphylococcal abscess, so this can erode into the pericardium and it can result in purulent pericarditis. So it is one of the most important complications of this Staphylococcus pneumonia, pericarditis. Okay, and the staphylococcal infection, if it occurs in less than 2 years of age children, there is increased chances of empyema development. Usually this pneumonia follows an upper respiratory tract infection, and sometimes, as I have said, it is complicated by other generalized staphylococcal septicemia, where it can involve joints, bones, muscles, pericardium, liver, mastoid or brain. How are you going to diagnose it? Diagnosis is by chest X-ray. Okay, so this also causes bronchoalveolar destruction. But the best diagnosis identification of this is by sputum. Sputum culture and staining for gram staining will help us to identify the staphylococcal pneumonia. There are many complications, as I have said. It can lead to empyema. It can cause purulent pericarditis or pleural cavity. It can even rupture into the pleural cavity, leading to empyema. Okay, pleural effusion. So all these are the different complications of staphylococcal pneumonia. The other pneumonia other organism which I would like to discuss is Haemophilus influenza. Haemophilus influenza, it is most common between the age group of 3 months to 3 years. It is most common in children between 3 months to 3 years. Okay. In the first 3 months, the infants generally have antibodies from the mother. So they have maternal antibodies which are protective for Haemophilus influenza, and as a result, they do not get the infection in first 3 months. In first 3 months, they do not get the infection because of this maternal antibodies. Okay. Now, the complications, it also causes pericarditis, empyema or meningitis. It can cause other complications. The main treatment of Haemophilus influenza is we use either ampicillin or you can also use cephalosporins. Okay, so it has all the generalized normal symptoms like chest pain, cough, which we will discuss in few minutes. Then the other organisms which I would like to discuss is gram-negative organisms. As I have showed you, there are many gram-negative organisms like number 1, E. coli or Klebsiella or Pseudomonas. So these organisms will most commonly affect the children who are less than 1 year of age, or when the child is malnourished, or it can also occur in deficient immunity. Whenever there is deficient immunity or in malnourished child or children who are less than 1 year of age, this might cause gram-negative infections by E. coli, Klebsiella or Pseudomonas. So here, how are you going to treat it? Treatment is by cephalosporins. Or sometimes you can even add an aminoglycoside to it. Okay, so these are the different infections which are caused by different organisms. So these organisms will cause either bronchopneumonia or lobar pneumonia. So thank you guys. I think you have understood something about the lobar pneumonia, bronchopneumonia. So thank you guys for watching my lecture. If you have any doubts, please comment it in the comment section. If you feel something is inadequate in this lecture, even then comment it in the comment section. Thank you for watching my lecture. In our next class, we will learn about interstitial pneumonia. So please subscribe the channel for more lectures. Thank you.